So we marked the cricothyroid membrane by doing an ultrasound, then we did the Cric. And what next? So as I told you earlier, then we need to do deliberate practices. For doing deliberate practices, we have designed this mini model of surgical cricothyroidotomy. So there are two ways you can do deliberate practices. One is mental visualization, which I'll be demonstrating. Like you have a model, you just visualize, okay, not actually doing the procedure. Like you are feeling the cricothyroid space, and then you are going the stab, and then you are imagining that you are passing the bougie, and over the bougie you are passing the tube, and then the tube is going into the cricothyroid space, the TT tube or the ET tube, and then you are inflating with the ambu, you bag the patient, and there's a chest rise. Here you will get that bladder inflation, and then you put EtCO2 and then confirm. So that's one way of doing deliberate practices. That is mental visualization or mental rehearsal. The second, which I'm going to demonstrate, is doing the actual procedure. So now because I need an assistant, but since I'm doing a deliberate practice, so I'll be doing it on my own. So now to the procedure. So this is basically a three-finger technique. First, the laryngeal handshake. Okay, you try to find out where the larynx is, and now this is the space. Okay, these are the two fingers used to stabilize the larynx, and then with the third finger, with your index finger, you feel the cricothyroid space, never leaving the space, and then you give this stab. Okay, and then you dilate with your finger. Okay, and then you pass the bougie. So because I am doing deliberate practices, I am not using any assistant. Okay, and then I'm passing the tube. I'm doing deliberate practice because in high stake procedure, you never know when the patient can come. So it is better that you do deliberate practices and master the procedure. Okay, so I'm stuck up. I need some assistance. So when we do real Cric, there is some pressure required. Okay, so out, inflate the cuff, and now so bagging, and now we are in the right place. Okay, and the second, of course, that should be the gold standard even in India, that we can attach the EQ to portable device. And now, and we have EQ number. How many? How much? 40. Okay, so that's again, it is in the right place. So we can do deliberate practices by mental visualization and by doing the actual procedure. Now to give the whole package, we have this silicone skin, but now we have like this skin, which is almost give you human feeling. And if you want to do a practice in obese patient, then this is a thick skin pad, which can be used to simulate a thick neck. So the idea is like what India needs deliberate practices and mini model. Like you don't have to go to a skill lab or to some other place or inside to simulation. You can do these deliberate practices in your offices. That is why we have designed this, and hopefully now with the deliberate practices and mini model, we will be able to master those high stake procedure. Thank you very much. So now I explain the mannequin. So this is the skin. You can use it multiple time by rotating it, and this is the cricothyroid membrane. You have to replace it. This is very low cost, and we have given like a substance which mimic human skin. Okay, so this is it. You have to just replace the cricothyroid membrane and the flap, and then you can just go. Okay, so this is very economical, I would say, befitting Indian condition, because we have been encountering the price issue, and hopefully this will solve that problem. So please go for this mini model, and please do deliberate practices by mental visualization and by doing deliberate practices. Thank you again for your time.